Hello, everybody. Today we have the wonderful Dr. Keerthy Sunder, and we will just be starting our presentation in a couple of minutes and just wait for a couple more people to trickle in. All right. It looks like for the most part, everybody is here. If Dr. Sunder, you are ready, I think we can go ahead and start now.
Awesome. Thank you indeed. And to Michelle and Sid for giving us this introduction to medical marvels. Totally looking forward to today's presentation and learning more about medical marvels and really having interns and pre-med students join the journey of what we are exploring at our practice here in Southern California in Palm Springs, as well as through telemedicine, and then also in other countries as we expand the concepts of neuromodulation and wellness. So as you can see, I'm both certified in psychiatry and addiction medicine. I started my journey as an obstetrician gynecologist, did a lot of work in women's mental health work. And now we do a lot of work with neurotechnology to modulate the brain and brain waves and chemistry and focus both on wellness and illness. And we have, over the last 10 years, been involved with medical students, pre-med students, residents, PA students, nurse practitioner students who rotate with us, do internships, and move on to flourishing careers, hopefully also in neuroscience, which is our area of expertise. Next, please. Go ahead.
So now for just a little bit more about Medical Marvels, for those of you who may not be too familiar with the organization. So Medical Marvels is a global nonprofit organization, and our primary goals kind of revolve around promoting medical literacy and affording interested pre-meds with medically related opportunities like the one that you guys are at today. At the end of the presentation, we will be talking about how to receive volunteer hours, which will be basically just emailing the email that we will offer at the end. And then now for just a really quick meet the board. My name is Siddharth Karthikeya. I organized today's event along with my co-partner who is not able to be here today. And I am the co-events manager for Medical Marvels.
Hi, everyone. I am Michelle Lee. I am one of the founders and executive directors of Medical Marvels. And thank you so much for coming and joining us today.
Thank you, Michelle and Sid. Over to the next slide, please. Okay, so I'll just get started. Today, I'm going to be talking a little bit about my own journey. And Sid had talked about it, that we have a lot of interns, potential interns, pre-med students, and high school students. And it's probably a good idea to give an overview of how I got started. At some point, I was also 16 and 18 and was trying to really decipher for myself what I wanted to do. But I was primarily motivated because of what I had witnessed with my own mother, who suffered from depression and bronchial asthma and so on. And that really got me on to understanding not only women's health, but also women's mental health, and took me on a long journey from India, where I graduated in Jaipur. It's a beautiful city called the Pink City, to doing my residency in obstetrics and gynecology, and then having the opportunity to pursue high-risk pregnancy, as well as perinatal psychiatry and addictions in in the United Kingdom, and spending several years there under tremendous mentors who taught me all about neuroscience, the overlap of hormones in pregnancy, postpartum, perimenopause, and so forth, and a lot of work in psychotherapy as well, and shaped many aspects of what I would ultimately end up doing. After that, I was recruited to the University of Pittsburgh. You can see I was right there outside. That's the date that I actually interviewed way back in the year 2000, some 20 plus years ago. So expect that unless you have strong genetics, you're probably going to lose your hair, if nothing else, over time, and so forth. But outside of that, medicine is an outstanding career, and it really has become even more outstanding with the introduction of technology, artificial intelligence, and the advances. So when I started med school, even neuroimaging, etc., were very much rudimentary and only in research settings. And today we have a situation where we are actually using neuro advances now on a continuing basis, not only in research settings, but also in clinical settings, like you'll see with ourselves. But a lot of what I'm going to be talking about is also about helping you all to understand the basics of how you can manage stress in your own lives. And what does neuroscience tell us about ancient practices like meditation, and how are we using technology to actually help us meditate on a regular basis, improve our cognitive aspects as well as our emotional aspects of our day-to-day life, and then continue to contribute in science and help humanity and human suffering. Next, please. So one important component of our life is to understand the difference between eustress and distress. So as you can see, there is a really challenged individual on right side of my slide. And there are folks who are basically running that 4-minute mile, if you like, and they are stressed, but it is what we might call good stress. And so that's the whole point about recognizing that stress and performance, it's not a linear graph. Next, please. So primarily, if you look at stress and performance, as you might have all seen when you are preparing for your exams and tests and so forth, you get very stressed. Sometimes you have sleepless nights. And if you have a particularly bad test, then it becomes difficult for you to settle down, and you may be sleep deprived. You may not sleep well, you may not look after your nutrition, and you may not be able to focus very well in a test, or especially if you're facing oral examinations, you're not able to think because you have a brain fog, or one of those senior moments where you completely, black out and you can't think clearly. That's because it may well be that you're really not understanding how to manage your stress, how to regulate it, how to get your body to perform on a continuing basis so that you too can run the 4-minute mile. And the key here in this particular slide is to understand that you want to work on your own mind and body in a way that stress is optimal. Because if you're going to be super stressed, you'll either get fatigued or you'll get very disorganized. You'll become very anxious and your performance will go down. What you want is what we call recruit the alpha coherent states. So a good balanced brain essentially stays in the alpha zone, like the meditators do, like the peak performers do, or people who have Zen states, as they say. They're singularly focused. And I bet you all experience those moments where you have clarity, you have focus, you have full attention, and you're not distracted, and so forth. And that is accomplished with many techniques, such as exercise, a good diet, and good sleep-wake cycles, and so forth. That's common sense, good management of your own mind and body. But as future doctors, scientists, peak performers, you all need to learn in your teens and 20s, how do you manage to regulate this machine, which is, if you see it in one way, the body is the machine full of organs and systems, and how do you manage to make it perform to the best capacity? And that is essentially to recruit the body and the brain, get it into the alpha states, get it into, parasympathetic or vagal tone, and so forth, and let it function in an optimal state. That's your peak performance state. Next, please. If you didn't do that, essentially, and you have experienced stress and what are called as automatic negative thoughts on a continuing basis, or perhaps you have a genetic leaning towards anxiety or depression, etc., which runs in your family, in that case, you ought to recognize that indeed stress has a lot of effects on multiple organs of the body, from something as basic as increasing your blood pressure to causing a coronary artery disease, heart attacks, stroke, and so forth, to affecting your gut with irritable bowel and nausea, vomiting, and so forth, the queasy feeling, the gut sensation that something is not right, to pretty much affecting most of the organs of the body long-term, because all systems are fundamentally interconnected through the sympathetic and parasympathetic and the central nervous system. Next, please. So what do you do as a young student who is going to look after yourself and perform very well and manage to compete in today's knowledge-based economy? You learn what now is a buzzword and a word that you probably all have come to understand, which is mindfulness. Mindfulness really means that you have elected to stay in the present moment. And that fundamentally means that you're recruiting your brain and your body to become more self-aware, and therefore you are understanding how your body and your mind performs, and you bring it to that on an intentional basis. Fundamentally, there are three components or qualities of what we call mindfulness. One is that you have to be intentional about it. That means that you have to make a choice to cultivate awareness. Awareness means not just aware of your own mind and body. How is it performing? How are you feeling? If you're feeling stressed, how can you do a body scan and figure out where you're feeling the stress? Some people actually have, the stress register itself in the shoulders. So it may be that you find that you're really carrying the weight on the shoulders, as they say. Some people experience aches and pains in the body. Others feel like they are wading through quicksand. The whole body feels very stressed, right? So you become aware, and you become aware also of the situation you're in. So there is your own awareness, and then there is the situational awareness. The second is that you pay attention. So you pay attention to the present moment, what is happening, and you pay attention to all the components of sensations and the thoughts and feelings that you are experiencing. And you pay attention by sitting for a moment and understanding that. So you learn how to become quiet with your own self. And then the third component of this is the attitude you bring. That is, when you are stressed out and you feel like this is a very unfair situation or a difficult situation or a complex situation where you don't find an exit strategy, then you ought to become kind to your own self. You have to learn and practice how to be compassionate and kind to yourself. How do you become curious? And how do you manage not to pass judgment? Since you know that if you had a good friend, you would not basically pass judgment. Same thing, you have to become your own best friend. And that's mindfulness. There are other things that will go through in the slide presentation that will tell you the power and importance of what it is to understand mindfulness, embrace it early on in your life to basically become the masters of your own destiny. Next, please. So we talked about mindfulness and stress. When you're stressed out, essentially, it's difficult to practice mindfulness, but that's what you do when you're not stressed out, when you're in eustress states, so that when you reach the stressful state, just like the practice that Olympic athletes do, just like the practice musicians do, chronic meditators do, they meditate even if there's nothing going on. Just like people who exercise they exercise on a daily basis because they know that that's what keeps the body in a prime condition. So the same thing, you basically practice mindfulness and you practice self-awareness on a regular basis. So when you are in distress states, you can actually get into eustress states. Next, please. And one of the core methods by which you can actually increase self-awareness, increase the concept of mindfulness, is meditation. I'm sure a lot of you have heard about it. There's plenty of social media presence with regard to the concepts of meditation. There are plenty of mindfulness meditation videos, techniques, and so on and so forth. Lots of resources and what have you, including teachers of meditation. It started way back when the Beatles worked with Maharishi Yogi, when the concepts of meditation became universally accepted and understood. But today, neuroscience research has actually demonstrated how meditation changes the structures of the brain, changes the brain wave activity and the chemistry of the brain to essentially put you in those alpha states of peak performance on a regular basis. So you walk around like what they call the mindful warriors of today's day and age. So self-awareness is the key. Next, please. And how do you do that? As I mentioned, if you meditate, then what happens is it recruits various parts of the brain. So initially, when you're sitting with meditation, for those of you who do it, the monkey brain, as they call it, because, you know, thoughts are automatic. They keep coming on a regular basis and so forth. So you don't control your thoughts. You become aware of those thoughts and you recognize that those thoughts will pass. So when you look at the brain, you will notice that as you basically start to meditate, initially there is the entire brain that is lit up on the left side of my slide and so forth. You can see the precuneus, the temporal cortex, the cingulate cortex, the medial prefrontal cortex. They're all lit up essentially. And then as you start to pay attention to the body and you settle down and you either use breath as a meditation technique or chanting as a meditation technique, whichever technique you practice on or you're taught to meditate on, you start to essentially quieten different parts of the brain. You can see in the second part of the slide, there's less lighting up of the parts of the brain. And then you see as the recruitment of the parts of the brain that are necessary to calm you down and to start to focus and make sure that you don't have your emotions all over the place and so forth. You'll notice the parietal lobe and the prefrontal cortex are being lit up now. And finally, you have the dorsolateral prefrontal cortex and so forth. So you can now focus. So essentially what is happening is it's a nice dance. As you start to practice more and more, you start to recruit the cortical areas to your benefit. Next, please. And this is an elegant study about practice makes perfect, if you like. So as you can see, it's a question of determining whether, you know, you want to have an avocado brain, which means the part of the brain that is associated with memory centers, you know, which is hippocampus. And do you want to have a huge hippocampus or do you really want a little peanut? And there's a very elegant study that was performed with the London taxi drivers and bus drivers, and they actually found that the taxi drivers driving through this maze of the underground tube system in London, you know, they actually had to pass a rigorous test. And that rigorous test essentially took them years to master. And once they managed to pass it, they had in fact mastered not just, you know, driving through the maze, but essentially what was found in the MRI studies was that the London taxi drivers who aced it and obtained their license, they actually had an increased size in the posterior part of the hippocampus, which is the memory center. And initially they thought maybe it was chicken and egg. Did they already have large hippocampi before they participated in training, versus was this a training, if you like, result? And they analyzed the data, and they actually found that it is the practice that resulted in an increase in the physical parts of the brain. So this is a wonderful study that tells us that you are actually able to profoundly increase the brain's capacity to do more and to improve your cognitive and emotional resilience by doing practice on a regular basis. So next slide, please. So how does this apply to mindfulness meditation? So we actually, our own research group, earlier we had the Mind and Body Treatment and Research Institute in Riverside in California, along with one of our interns who's currently in med school and wrapping up and going to move forward with his psychiatry residency training, Jeff Bonin. We basically studied and looked at the literature and the published literature, which talks about mindfulness and how does it create resilience. We focused mostly on patients with post-traumatic stress and addiction. And what we found is that there are clearly physiological changes in the brain and bodies of mindfulness practitioners. And this has actually been studied very elegantly by Professor Sarah Lazar from Harvard. And you can check her out, and these slides will be shared with all of you. And in their study, they actually looked at novice practitioners or folks who had not actually meditated and put them through about 8 weeks of simple meditation, breath-based meditation. And that study you can actually access through the PubMed website. We've posted a little link there of mindfulness practice that leads to increases in regional brain gray matter density. There's also a TED Talk that Professor Sarah Lazar has given on how meditation actually increases your various parts of the gray matter, as you can see in the neuroimages out here, where the regions were affected specifically in certain areas associated with emotional regulation as well as memory. Next, please. One of the technologies that we have actively been involved both in research as well as with its use in clinical practice is NewCalm. And you can check their website out. It is the world's first and only patented technology. It has 2 FDA patents for stress regulation. So for those of you who find it difficult to sit down and do it on your own, NewCalm actually guides you through the whole process through an app that you have on your phone, and as well as binaural beat meditation tracks. And I can show that to you hopefully on this screen. So that's what the app looks like. So you can actually download an app for NewCalm, and it's got various tracks related to sleep and towards meditation. So essentially there are 2 components. There is a biosignal processing disc that you apply at the acupressure 6 point, and that's one patent. And then the second one is the binaural beat meditations, very sophisticated engineering from Harvard scientists, more than 30 years of research that has gone into putting you quickly into the alpha states. So NewCalm is really an outstanding technology which we use in our clinical practice for anxious patients, and it's wonderful to utilize it on a regular basis. The track that is very useful is the rescue track. You use the rescue track in the mornings and the deep sleep in the night, and you actually get into very calm states, and your whole day goes very well because, of course, your whole body is in a good, what we call as vagal balance, as opposed to the stress fight or flight mode. It gets into the rest and relax mode and so forth. So next, please. This is another slide related to NewCalm's research. You can go on newcalm.com and you'll actually look, you'll be able to review some of the published research related to it. And and why it is a powerful technology that probably brings neurotechnology to the ancient practices of mindfulness meditation. Next, please. The other part I wanted to emphasize a little bit on, I think, Sid, you can wait for a second as I speak about it, and then you can play the video, is the fact that when you're stressed out, you might have all seen that sometimes for some of you, your disposition is that, you might just lose your appetite. And for others, it may be that they have the runners. That means they, sort of get more of diarrhea and so on and so forth when they're hugely stressed out. Or for some, they become very nauseous, because we know that the gut is the second brain. And the gut has more serotonin receptors than the brain itself. And also, the gut is regulated heavily by the vagal nerve, that is really the freeway that goes between the intestines and the brain. And so there are afferent and efferent pathways that go between the brain and the gut. So when you're stressed out, it's not just the brain and the mind that gets stressed out, and the brainwave activity gets into either becoming too sleepy, that means the delta activity and so forth, and you say, I can't do anything, I'm just going to go under the bed sheets, or you basically become highly stressed out and so forth, and you have random thoughts crossing your mind, which means you're getting into the beta and gamma states that are not helpful and so forth. So in order to get you back into the state of alpha, we talked about using mindfulness meditation, using neurotechnology to assist and so forth. But you also need to focus on nutrition. You need to focus on the fact that if you are going to actually compete, for example, let's say you're sitting the MCAT and you've got to, for one whole year, you're going to have to study. You're not only doing your undergraduate, but you also are preparing for MCAT. You're writing your applications and so on and so forth. And you've got to do it all. And you have to compete with everyone else who's competing and so on. So you need to master your brain and master your body. You need to become, as I mentioned, masters of your destiny. So you must understand the science behind the brain and body's optimal functioning. And one of them is to understand that the gut is a very sensitive organ. You don't want to become a leaky gut. That means you don't want the lining of the intestine to start, allowing things that should not cross that barrier to cross it because of stress. And you should eat healthy, and you should get a balanced diet such that the good bacteria populate and the bad bacteria go down, So this is where, there is a wonderful animation video that our team put together. There's a wonderful society called the Little Brain, Big Brain Society. And for those of you who are interested in neuroscience research, gut brain research, and functional medicine, you should make it a point to join that society. It's courtesy to them that we actually have created an animation video. So Sid, please go ahead and play this video. Maybe you can expand it. So as you can see that you've got neurodevelopment very early on. And if you have neglect, conflict, or deficit early childhood, such as losing a parent or having mental illness and so forth within the parental, it can put stress on your genetics. And so epigenetically, you may be primed towards anxiety and stress. And so that might place you in a position of high stress. And so you have to be more cautious. Even if that wasn't the case, you just have to recognize that, anxious states basically in the big brain, they do affect the little brain. And there is an entero, that means intestinal endocrine system. And the diet and the enteric nervous system, which is the vagal nervous system, they all constantly talk through vagal efferents and afferents and so forth. And they change the microbiome. Maybe you want to play it again, Sid, just one more time, kindly. So again, we've presented a cartoon here. The mind is like a monkey. And so you got a big brain and a little brain. And so very early on in development, when you're born, you can actually be affected because of multiple factors. And if you're stressed, then that creates a disruption of the homeostasis of the energy in the brain, and it can affect your gut microbiome and move that whole balance towards, gut microbiota that are not healthy. And that is really the enteric nervous system essentially also getting affected by stress. And diet plays an important role. And in stress, if people ignore it and stop eating or don't eat the right things, which is balanced and so forth, they're just going to create a gut-brain dysregulation, right? So you always want to make sure that you're taking good care of yourself, both your brain, the mind, and the body. Next, please. Next, please. So again, just from the nutritional aspect of it, we had presented some of our work also related to NuCalm and nutrition at the international conference in China a few years ago, just before the pandemic. And there have been robust associations between nutritional quality and mental health. And diet is a significant component, including the addition of nutraceuticals that might well be from utilizing adaptogens such as ashwagandha, utilizing supplements such as turmeric and ginger and so on that present a good environment for the gut. Next, please. I just wanted to spend a moment on who we are and what we do. Well, as I mentioned very early on, we have an elegant and thriving practice called Karma Doctors. Check us out on karmadocs.com. We also have a neurotechnology practice. We'll do another presentation on TMS next time with Sid. Karma TMS. We also have a small foundation that is in honor of my dear mother, who inspired me to pursue mental health and wellness related research. And so all of you are welcome to participate. We do a lot of work with arts and mental health, science and mental health, and public policy and mental health. We have presented at various conferences. One of them is the Society for Brain Mapping and Therapeutics, along with the good Dr. Deepak Chopra and Dr. Baba Khatib, extraordinary neurosurgeon who has pioneered the concept of the World Brain Mapping Foundation. Is the chairman and founder of the Society for Brain Mapping and Therapeutics. And a lot of the interns, you can see, we are actively involved with the World Brain Mapping Foundation and the research, which includes neuroscientists from all over the world, neuropsychologists, computer scientists, neurosurgeons, neurologists, psychiatrists. So it was one of a kind meeting, and interns who rotate with us. And you can see a lot of them at the Cure Gala gathering in Los Angeles. Many of them are interns who interned with us and are pre-med students. So they get a lot of exposure in science, technology, neuroscience, wellness, and research. So that's part of what we do. And we are excited that Medical Marvels is going to collaborate with us. And we are looking forward to having you all get in touch with us. Whether you're interested in neuroscience or not, we have a lot of areas that you can collaborate, including social media, including psychology, and so on and so forth. So just reach out to us. We would welcome that collaboration. Next, please. So again, you'll be getting the slide presentation. For those of you who are on and watching us, you can take our emails down. Sid is going to be coordinating with our practice and our setup to help you navigate an internship. You may need a month's internship, a week's internship. Maybe you want to work with us for 6 months. You want to work internationally and so forth, or you're not in California, but you want to come and spend some time with us. We are open to all variety of collaboration. We want the future should be bright with more folks focusing on brain and wellness, given the epidemic of stress that we're experiencing in the planet. So thank you. Next, please. Yes, we are open to questions at this point, so feel free to go for it.
If you are comfortable unmuting yourself, you may go ahead and do so. If not, the chat is also open for any questions you may have. I also do have a couple of questions that I did get earlier when people signed up. And oh, I see that Shania raised her hand. You can speak.
Please.
Hi, Dr. Sunder. It's so nice thank you so much for sharing all the incredible information. Like, I think you really highlighted how mental health is truly multifaceted in so many ways. I'm currently studying health science at Queen's University, which is in Kingston, Ontario, Canada. And there's definitely been like a push towards understanding like mental health maintenance better and trying to find like interventions that can definitely like help with that, like the app that you kind of highlighted. So I'd love to get involved with your research in mental health. And I guess I was just wondering if you've done any research into mental health and how that can be kind of embedded in the curriculum for medical residents of different residency programs.
What an outstanding, and thank you indeed for asking the first question and so forth and getting us all started. You know, that is one of the areas that we want to actually research, which is one of the reasons when Sid got in touch, I was very interested because I think even when I was doing med school, you know, there was very little focus on psychiatry and mental health and nutrition. And I think it has gotten better. Different med schools do it much better now and so forth. And in residency programs, it's much more of a focus on illness, as you know, as opposed to wellness, you know. And so this component of introducing technology, introducing wellness indicators, mindfulness, meditation, and so forth, perhaps is more skewed in certain institutions versus the others and should become more universal. So I'm delighted you asked that question, and we would love to explore that possibility with you and others. So please reach out and give us some suggestions on how we can do that, and what are the ways in which we can collaborate in improving this component in terms of not only training and self-improvement, but also, as you mentioned, as part of the curriculum itself in med schools and residencies.
Absolutely. Thank you so much. I'll definitely reach out.
For sure. I think we have one question is, could students work or intern remotely? Yeah, absolutely. They can. The only thing is we have an entire academic division to our practice. And we need to essentially have a lot of commitment, because what happens with remote is that we are not able to monitor a lot of the interns. So they are very much on their own, as opposed to if they are coming, you know, face-to-face at the clinic in Palm Springs in California. But that doesn't mean that we're not open to it. We have a lot of interns who've done it. And so perhaps we'll just have to create a scale of how committed you are, how punctual you are. Are you doing mindfulness work on yourself? Are you using technology to make sure that you're self-aware and self-regulated? And then we'll select those. Maybe we have to appoint Sid to do that screening. I was just kidding. So I think absolutely reach out to us. We'll work with your schedules and we'll get you to intern with us and get you exposed to some of the work that we do. But for those who really want to see transcranial magnetic stimulation and NewCalm in action with our population in California, I think even coming out for a week or so will give you more than, you know, your, you know, bang for the buck, so to say, in terms of time, because you'll just have a very sharp learning curve and so forth, and you'll really become much more equipped, irrespective of whether or not you choose neuroscience as a career. And what's the email we reach out to? Yes, it's there. It was the last slide. Maybe you want to go back to that slide. Yeah. And, you know, so there you have it. You can copy it down. We'll keep that open as we go through the questions.
Then, Dr. Sunder,
yeah,
really quick, I got one more question. Someone was asking, actually, we can go through the ones after this one. Let's go through the ones that were sent a bit earlier. But someone just asked me, how would an internship work, and what is the process like?
Yeah. So really, I think a lot of the internship is if you're going to come to us, if you're based out of Southern Cal, or you decide you're going to come for a week or so, we'll work with you logistics wise and so forth. And most of the students who do like a week long or 2 week long internship, they come and stay locally, and then they commute on a daily basis. They spend their time with us, and we have a very good schedule for them so that their learning is accelerated. You know, there's interaction with both myself and with our physician assistants, nurse practitioners, and the technologists. And you actually get, we do a HIPAA, all those disclosure agreements, business associate agreements, so that you're basically cleared for, interactions with our practice patients and so on. And then you come, you witness some of it and so on. It's too little time for you to train as a technologist, but you basically shadow us, and you get a lot of understanding of applied neuroscience, because we are very much a translational academic research and clinical facility. So you get to understand how various advances in neuroscience, including probiotics and so forth, are being used in actual clinical practice with serious psychiatric disorders like depression, anxiety, bipolar disorder, ADHD, concussion, and so on, including wellness, stress, anxiety, and so forth. So that's one piece. For the remote, we basically work with folks to actually we understand what their talent skill sets are, and we get them to participate in some of our work related to our website, working with our web design and our marketing team. They participate in some of our business development meetings, so they get to understand how a practice is created and how it scales its business, how we basically use digital marketing in order to inform, educate, and create awareness in society. So there's that piece of it. There's also the piece of shadowing some of our practitioners and myself as we do assessments and so forth. And we are open to discussing. Some of them have written blogs because they're very good at writing. And some of them have posted on social media and created more mental health awareness and so forth. Some have specific goals. They want to do it for a whole year, but they want to devote just 2 half-days a week for an entire year, or 10 hours a week for an entire year. So it's really very much customized to each individual's requirement and their goals. And somebody asked about high school students. Absolutely. High school students are most welcome. You just have to be very, you have some criteria. You need to smile, you need to be cheerful, and you need to be motivated. Is that an okay requirement, Sid? It passes all the human resources requirements here?
I think that is a very reasonable requirement.
Okay, good.